On November 1st, 2022, the Centers for Medicare and Medicaid Services, or CMS, released a final rule with updates and policy changes for the Medicare payments under the Physician Fee Schedule, or PFS, and other Medicare Part B issues, which will take effect on or after January 1st, 2023. The final rule for the calendar year 2023 PFS is one of several rules that are part of a larger plan by the administration to create a more fair health care system with better access, quality, cost, and innovation. So let's check out what was finalized. We talked about the proposed rule in this video, so you can compare what was proposed versus what was finalized. Let me give you some quick background on the Physician Fee Schedule. Since 1992, Medicare payment has been made under the PFS for services of physicians and other billing professionals. Physician services paid under the PFS are furnished in various settings, including physician offices, hospitals, ambulatory surgery centers, skilled nursing facilities, and other post-acute settings, hospices, outpatient dialysis facilities, clinical laboratories, and beneficiaries' homes. Payment is also made to several types of suppliers for technical services, most often in settings for which no institutional payment is made. But before I get into the highlights, let me say, hey there and welcome. If you are new here, you don't know me yet. I am Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've served hundreds of students and helped them transform to become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Consider subscribing to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. And don't forget to hit that bell for notifications of my weekly videos. Help us continue to spread the word to others. So let's talk about some of the things that are happening. Split or shared E&M visits. For calendar year 2023, CMS finalized a year-long delay of the split or shared visits policy established in rulemaking for 2022. This policy determines which professional should bill for a shared visit by defining the substantive portion of the service as more than half of the total time. Therefore, the calendar year 2023, as in calendar year 2022, the substantive portion of a visit is comprised of any of the following elements: history, performing a physical exam, medical decision making, spending time more than half of the total time spent by the practitioner who bills the visit, and as finalized, clinicians who furnish split or shared visits will continue to have a choice of history or physical exam or medical decision making, or more than half of the total practitioner time to define the, quote, substantive portion, end quote, instead of using total time to determine the substantive portion until calendar year 2024. In telehealth services, for calendar year 2023, CMS is finalizing a number of policies related to Medicare telehealth services, including making several services that are temporarily available as telehealth services for the public health emergency available at least through calendar year 2023 in order to allow additional time for the collection of data that may support their inclusion as permanent additions to the Medicare telehealth services list. CMS finalized their proposal to extend the duration of time that services are temporarily included on the telehealth services list during the PHE for at least a period of 151 days following the end of the PHE. In alignment with the Consolidated Appropriations Act of 2022, or CAA 2022, CMS confirmed that they plan to implement the telehealth provisions in sections 301 through 305 of the CAA in 2022. This will be done through program instructions or other sub-regulatory guidance to make sure that the end of the PHE doesn't cause any problems. These policies will stay in place for 151 days after the PHE ends. For example, physical therapists, occupational therapists, speech language pathologists, and audiologists will be able to provide telehealth services from anywhere, including the beneficiary's home. Some services will also be available to be provided through audio-only telecommunication systems. The CAA 2022 also puts off the need for a face-to-face visit for telehealth mental health services until 152 days after the end of the PHE. CMS finalized the proposal to allow physicians and practitioners to continue to bill with the place of service indicator that would have been reported had the service been furnished in person. These claims will require Modifier 95 to identify them as services furnished as telehealth services. Claims can continue to be billed with the place of service code that would be used if the telehealth service had been furnished in person through the later of the end of calendar year 2023 or the end of the year in which the PHE ends. Some things in behavioral health services. In light of current needs among Medicare beneficiaries for improved access to behavioral health services, CMS has considered regulatory revisions that may help to reduce existing barriers and make greater use of the services of behavioral health professionals, such as licensed professional counselors, or LPCs, and licensed marriage and family therapists, or LMFTs. Therefore, CMS is finalizing the proposal to add an exception to the direct supervision requirement under our Incident to Regulation at 42 CFR 410.26 to allow behavioral health services to be provided under general supervision of a physician or non-physician practitioner, rather than under direct supervision, where these services or supplies are furnished by auxiliary personnel, such as LPCs and LMFTs, incident to the services of a physician or MPP. CMS is also clarifying that any service furnished primarily for the diagnosis and treatment of a mental health or substance use disorder can be furnished by auxiliary personnel under the general supervision of a physician or MPP who is authorized to furnish and bill for services provided incident to their own professional services. CMS believes that this change will facilitate access and extend the reach of behavioral health services. Finally, CMS indicated in the final rule that they intend to address payment for new codes that describe caregiver behavioral management training in calendar year 2024 rulemaking. CMS's 2022 behavioral health strategy has a goal to improve access and quality of mental health care services and an objective to, quote, increase detection, effective management, and or recovery of mental health conditions through coordination and integration between primary and specialty care providers, end quote. So during the calendar year 2017 and 2018 PFS rulemaking, CMS received comments that initial visits for behavioral health integration, or BHI, should include in-depth psychological evaluations done by a clinical psychologist, or CP, and that CMS should think about letting professionals who weren't eligible to report the approved initial visit codes to Medicare serve as a primary hub for BHI services. Well, CMS is finalizing their plan to create a new general BHI code to describe a service personally furnished by clinical psychologists or clinical social workers to account for monthly care integration, where the mental health services provided by a clinical psychologist or clinical social worker are the center of care integration. This is because the need for mental health services has increased, and CMS has received feedback on this. So CMS is also putting the finishing touches on a plan that would let a psychiatric diagnostic evaluation be the first visit for the new general BHI service. There's also some things going on in chronic pain management and treatment. CMS finalized new HCPCS codes G3002 and G3003 and valuation for chronic pain management and treatment services, or CPM, for calendar year 2023. They believe the CPM HCPCS codes will improve payment accuracy for these services, prompt more practitioners to welcome Medicare beneficiaries with chronic pain into their practices, and encourage practitioners already treating Medicare beneficiaries who have chronic pain to spend the time to help them manage their condition while within a trusting, supportive, and ongoing care partnership. The finalized codes include a bundle of services furnished during a month that CMS believes to be the starting point for holistic chronic pain care, aligned with similar bundled services in Medicare, such as those furnished to people with suspected dementia or substance use disorders. They have finalized the CPM codes to include the following elements in the code descriptor: diagnosis, assessment, and monitoring, administration of a validated pain rating scale or tool, the development, implementation, revision, and or maintenance of a person-centered care plan that includes strengths, goals, clinical needs, and desired outcomes, overall treatment management, facilitation and coordination of any necessary behavioral health treatment, medication management, pain and health literacy counseling, any necessary chronic pain-related crisis care, and ongoing communication and coordination between relevant practitioners furnishing care, such as physical and occupational therapy, complementary and integrative care approaches, and community-based care as appropriate. Colorectal cancer screening. For calendar year 2023, CMS is finalizing, as proposed, 2 updates to expand the Medicare coverage policies for colorectal cancer screening in order to align with the recent United States Preventive Services Task Force and professional society recommendations. I already know one physician who is very happy about this. First, they are expanding Medicare coverage for certain colorectal cancer screening tests by reducing the minimum age payment and coverage limitation from 50 to 45 years. Second, they are expanding the regulatory definition of colorectal cancer screening tests to include a complete colorectal cancer screening where a follow-on screening colonoscopy after a Medicare-covered non-invasive stool-based colorectal cancer screening test returns a positive result. A functional outcome of the policy for a complete colorectal cancer screening will be that for most beneficiaries, cost sharing will not apply for either the initial stool-based test or for the follow-on colonoscopy. Both of these policies reflect CMS's desire to expand access to quality care and to improve health outcomes for patients through prevention and early detection services, as well as through effective treatments. Their revised colorectal cancer screening policies directly advance their health equity goals by promoting access for much needed cancer prevention and early detection in rural communities and communities of color that are especially impacted by the incidence of colorectal cancer. CMS's policies also directly support President Biden's cancer moonshot goal to cut the death rate from cancer by at least 50% over the next 25 years and addresses his recent proclamation of March 2022 as National Colorectal Cancer Awareness Month. So you have learned that the Physician Fee Schedule 2023 Final Rule was released November 1st. You have also learned about the telehealth, behavioral health, and split shared services guidance that have changed as a result. My final thoughts. There is a lot of change, and we anticipate that regularly. But I think CMS is really living out their plan to create a more fair healthcare system with better access, quality, cost, and innovation. Now, you already know there's a lot happening with evaluation and management services, and I want to dedicate an entire video to that. So I didn't include that here. I will also update the leveling tool to include the other services changed as a result of the new guidance. So be on the lookout for all of that. I am Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. And if you are interested in more information on these tips and others on how to become a certified marketable medical coder, then check out these videos and check this out.
Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder.
If you liked the video, which I hope you did, don't forget to let me know by hitting the thumbs up, hitting the subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you, so let me know you were here by providing a comment, asking a question, saying hey. You can also give me a little love by sharing this video on your social media platforms and tag me in your video share at prncoding.edu. Let's stay connected and connect others. Well, look at you staying until the end. I appreciate it. And before you go, let me know in the comments you were here by using the hashtag PFS2023. Also, let me know if you have specific questions or items that you would like to see discussed right here on our channel. If you want to learn more about the wonderful world of health information, medical coding, and or compliance, then watch one of these videos. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care and thank you so much for watching.